Hi class, this is Tess Garland and this is my presentation on interprofessional collaboration. The Institute of Medicine report titled The Future of Nursing, Leading Change, Advancing Health identifies interprofessional collaboration among healthcare providers as an essential part of improving the accessibility, quality, and value of healthcare in the United States. The report highlights 4 key messages, one of which emphasizes nurses' roles as full partners with physicians and other healthcare professionals in redesigning healthcare. Another highlights that nurses must be accountable for our own contributions to delivering high-quality care while working collaboratively with leaders from other health professions. This message emphasizes the importance of nurse leadership in the advancing interprofessional collaboration in all settings. Interprofessional collaboration is based on the premises that when providers and patients communicate and consider each other's unique perspective, they can better address the multiple factors that influence the health of individuals, families, and communities. No one provider can do this alone. Several healthcare factors contribute to making interprofessional collaborative practice a desirable model of care in the effort to improve delivery of 21st century healthcare and improve health outcomes overall. These include current concerns with quality and safety, healthcare shortages, and core competencies for team-based care. The link between interprofessional collaboration and quality and safety has been highlighted in several IOM reports. These detail the poor quality of care and high rate of preventative medical errors that occur when health professionals operate in silos. Collaboration might simply mean handing the patient chart to the next provider, or more detailed, a team huddle before each shift change to review patient status and plan of care. A lack of communication, however, can jeopardize the delivery of care and the safety of the patient. It can also lead to gaps in coverage or to an oversight by a responsible professional and loss of information. A silo mentality eliminates the opportunity to build and learn from the strengths of others. Changing this way of thinking is dependent on educating, practicing health professionals as well as students. Doctors and nurses make up the largest group of individuals within the healthcare environment. The relationship between these two groups is a major determinant of the quality of the healthcare practice environment. An insufficient supply of essential personnel, such as the RNs, is a critical stressor for hospitals. Studies have helped to establish a relationship between the inadequate hospital nursing staff and increased risk of adverse patient outcomes, including mortality. So prolonged shortages also might reduce the quantity of patient care, increase operating and labor costs, and decrease the efficiency and effectiveness of care provided. Looking ahead, recently published projections indicate large demographically driven shortages developing in the next decade. A projected shortage of healthcare providers will require clinicians to practice in smart and efficient ways that rely on excellent interprofessional communication. Appropriate and effective communication strategies are a vital element in the delivery and quality nursing care. Poor communication in nursing can lead to lawsuits and avoidable patient harm. According to the National Voice for Baccalaureate and Graduate Nursing Programs, the American Association of Colleges of Nursing believes that education plays a significant influence on the knowledge and competencies of the nurse clinician. Graduates with higher education demonstrate stronger skills in the areas of communication, assessment, cultural sensitivity, resourcefulness, the ability to apply knowledge, and scientific reasoning. Because RNs work as part of the interdisciplinary team with colleagues that are educated at the master's degree or higher level, there is an expectation for nurses not to be the least educated member of the healthcare team. Nurses are primarily responsible for direct care and care coordination. In order to ensure patient safety and outcomes, we must recognize the complexity involved in providing patient care and understand the value and need for higher education. As a nurse educator, one important role requires a high level of general and specific knowledge in order to identify needs in healthcare provision. This specific aspect includes identification of healthcare trends that impact the context in which we will be practicing our advanced practice roles. As millions of young people around the globe search for a job that is financially stable and purposeful, the healthcare field provides both. The skills that the healthcare workers need is changing as the challenges faced by healthcare workers around the world are ones that in some cases were never imagined, much less trained for. Nurse educators have to prepare the health workforce of the future to be prepared and ready for anything. As a nurse educator, we must identify misinformation and serve as a source of evidence-based, best practice information to support patients, promote safety, and minimize internet-powered self-diagnoses and misguided policies. Nurse educators have the opportunity to inspire new nurses, shape the next generation of nurses, and model and guide nursing students through the process and importance of evidence-based, best practice information that will drive the best outcomes for our patients, promote patient safety, and serve as a foundation for healthcare policies. Nurse educators play a vital role in ensuring that the next generation of nurses is prepared to meet the growing demand for healthcare services. Master prepared nurse educators are also better prepared to shape the future of the nursing profession, focusing on holistic patient care, illness prevention, and promoting community health. They are professional nurses who are trained to deliver information to other nurses and students who understand their challenges as well as how to convert critical and life-saving knowledge, mitigate mistakes and streamline processes, and identify opportunities to improve the hospital processes. Therefore, nurse educators serve as an important role within the hospital system, which is beneficial to overall healthcare system goals. With the steady increase in chronic illness across the nation, school nurses in particular are tasked with providing direct health services to children throughout the school day that is competent and efficient. Uncontrolled asthma is a major reason children miss school days each year. Without a plan in place to manage asthma symptoms, students' health and safety are put at risk. Having the necessary information in the hands of the school nurses is the most proactive way to ensure the children's asthma symptoms are controlled in school. My proposed evidence-based change is for school-aged children who are diagnosed with asthma. Does the implementation of a school nurse-led asthma management program improve symptoms of asthma, absentee rates, incidence of medical emergencies, school performance, and overall student satisfaction? The asthma management team, including the school nurse teacher, the health director, building administrators, teaching faculty, counselors, coaches, and maintenance will collaborate to properly identify students with asthma, assess the symptoms appropriately, implement asthma action plans for all students, provide asthma education for staff, students, and families, and monitor data to evaluate the program. Implementation of this program will enhance the student health and learning outcomes and will facilitate the institution's vision. The team that will implement this proposed evidence-based practice includes the director of the health, the SNTs, school nurse teachers, and other per diem nursing staff, the school administrators, the classroom teachers, the physical educators, the sports faculty, the coaches, and maintenance staff. The Director of Health will be responsible for policy change, implementation, and provide support and resources to the team. The SNTs and other nursing staff will be responsible for educating school staff, students, and families of the students, as well as actually roll out the policy within their health offices. The nurses will be responsible for communicating with all staff, as well as any providers in the community that are the sole caregivers for the students. They will also be responsible for monitoring signs and symptoms, administering medications, assessing students, identifying barriers for implementation, maintaining clear and effective communication with all staff, parents, guardians, and other healthcare providers, and monitoring progress. The school administrators will be responsible for mandating appropriate involvement of staff, providing time within staff meetings and other designated days for educational services and trainings, communicating with parents and guardians, and maintaining a healthy environment to promote learning. The classroom teachers will be responsible for consulting with the nursing staff, reporting symptoms experienced by students in the class to the school nurse, and to communicate with the school nurse any barriers to learning for the asthma student. The physical education and coaching staff are responsible for following the students' asthma action plans under guidance from the school nurse, allowing students to use prescribed medications for asthma as needed, and to promote a safe setting for exercise and participation in sports. Finally, the maintenance staff is responsible for inspecting the school building for potential asthma triggers, following a regular cleaning and maintenance schedule, and providing information to staff, parents, and guardians, as well as the students, about air quality problems and solutions. Professional communication in the clinical setting is healthcare professionals' relationships with each other, as well as their exchange of knowledge and skill for making appropriate clinical decisions about patient care. Healthcare professionals clearly need to establish professional communication with each other. Providing quality and safe care to patients greatly depends on healthcare professionals' collective understanding of care plans, which in turn acquired through their effective communication with each other. Ineffective professional communication compromises the quality of care provided to the patient and can be caused by differences in the individual's official positions, roles, and interpersonal conflicts and power struggles. To establish a culture of healthcare professionals who communicate effectively across the authoritative gradients and transitions of care, it is suggested to enforce clear protocols to report potential breaches in safety. Also, specific team training can help to establish the desirable climate among providers and nursing staff. This concludes my PowerPoint. Thank you.